All right. Hey, our doctors are out of the operating rooms and all the other stuff. And live from Stewart, Florida, Dr. Ed Southard. How are you, Doc?
All right, thanks. Yourself? Traffic was bad today. Sorry.
Uh-oh. Turn your mic up a little bit too. Yeah, it's a
How's that? Better?
little chaotic in Stewart, huh?
Say again?
A little chaotic down in Stewart. You're busy. Well, that's good. It's good that you're
Yeah,
busy.
yep. The timing. So, how's everybody doing?
Doing okay. What are you seeing now? Obviously we're getting close to the snowbird time. Get a little busy down there.
I've been having a couple of fractures rolling a lot lately. The standard run of the mill. You still get your frozen shoulder, your bursitis, your regular knee, knee joint pains, back pains. But I've been seeing a little bit more of the fractures, which is interesting because I haven't seen the population change much. It just may be just a wave of people doing certain things and tripping and falling and being more active and injuring yourself. And operative fractures too. So it's
Yeah, like cleaning gutters and stuff like that, like we were doing.
no, none of those, fortunately.
Well,
Falling off motorcycles, one or two of those, a couple of bike injuries, but the pickleball wave is slowing down. I haven't seen a lot of damage from pickleball, so I guess the full contact pickleball league is yet to pick up again.
that's great. Oh
So
man. Yeah, but that's interesting about the fractures. You mentioned frozen shoulders. I mean, does that happen very often? Because it seemed like that was something that was extremely rare.
I think frozen shoulder is one of these unique diagnoses that um, it's one of these things we call a diagnosis of exclusion. There's a certain population of patient that has a little bit more of a predilection towards it. Middle-aged females, your diabetics, endocrine patients, thyroid, hypothyroid, parathyroid, so forth. Um, I can't say it's uncommon, but it's one of these things where the X-rays are negative, the MRI is negative. Well, that's not exactly true, but the X-ray is negative, the exam looks like it is, and there's no other explanation for it. And then if you do get an MRI on these patients, which most often you don't even need to, they show an inflamed, thickened, tight capsule. It's not as uncommon as you think, um, but in order to really say I have frozen shoulder, you have to do the full gamut of workup. Um, that being said, there are plenty of people that get stiff shoulder. They behave like frozen shoulder, but there's an underlying cause, that's resulting in that. I mean, I have a lady today I just saw. Same thing. She has pathology in her shoulder, but her biggest problem is that she has a stiff shoulder. So she has a reactive capsulitis to whatever's going on in her shoulder, and same thing. Doesn't have the mobility, can't use the arm, so on and so forth. So it's not uncommon, but it's not super common.
Well, then are you looking which is more common in that situation? Is it male or female?
Female. Yeah, it's middle-aged
Really?
females. Yeah, it's middle-aged females. Book says 30, 40 to around 60 or so. Slightly more common. And I'm not saying, it's 10 times more common in women than men. It's about a 2-to-1 ratio. But it's, women just tend to have a more of a predilection towards it. It just happens to be one of those things.
That's weird because I mean, usually when you hear something like an ACL or something like that, that they're kind of predisposed to stuff like that too.
Right. I mean, that's a totally different conversation. I mean, women athletes in particular, and it's because of the angle that their legs are. It just happens to be the neuroprotective mechanism, as well as the Q angle where their legs come down. They have a higher incidence of ACL injury, and that's why a lot of athletes, there's a lot of real focus on neuroprotective training, getting your proprioception and allowing the supporting musculature around the knee to be more finely tuned to the needs of a female athlete. And we've talked about this, I think, several weeks ago. the amount of force it takes to tear an ACL or to tear a PCL. A running back, in the NFL, for example, or a female athlete that's doing a cutting sport like basketball or say field hockey or soccer, they see those forces across their knee every single time they make a move to the right or to the right or the left. And if it weren't for the muscles around there keeping the knee from shifting, you would, in theory, tear your ACL every time you cut, but you don't. And it's not because of the ACL; it's because of everything else that's around there.
Yeah, I mean, just being around the men's and women's basketball team, you see a lot of horizontal drills in both, but I think more on the ladies' squad than you do with the guys.
Oh yeah, no, women, like I said, women are, especially your higher level athletes, there are specialty programs doing things like plyometrics and neuro physiologic training to really get the body to understand the knees position in space, so to speak. I mean, it sounds like a very theoretical conversation, but it's getting the female body to adapt to the needs of sport as it pertains to the ACL. They call it neuroprotective therapy. Now, why is it neuroprotective therapy? Because it's, again, proprioception. It's your ability to recognize your position in space and the knee's ability to recognize its position in space, and what the muscles have to do to overcome. So I mean, it really is that is what it is.
Boy, that's that is really amazing. It's stuff I would never even think about,
Right.
but it is changing. And you also see, of course, there are pieces of equipment that they're using in pregame as well that might be a little different than what the guys would use as well. So I guess that all fits into what you were talking about.
Right. Well, I mean, it's there's different. I mean, look at the difference with the difference in warm-ups. Difference in technique, and we've come a long way in sport. I mean, if you look, I mean, you played baseball, at a professional level. When you were in high school, did you ever hear of a pitch count?
Are you kidding?
Exactly.
It's
Little league. You know what I mean? It's there's just things that you just don't speak of, and that's the most basic. I mean, little league shoulder, little league elbow. What is that? Um, when you see kids that are having proximal humerus fractures because of a throwing injury, you know, you got to change the way we do things. You know what I mean? It's just a different world.
Well, and I think you talk about like the little league. Even when I played, which was the dinosaurs were roaming around Westchester, California. But we did have pitch counts in, but we did not in high school. And we had scouts floating around all the time at our high school, and I'll never forget Al Campanis of the Dodgers said complete games. He said, "Kid, think complete games." That's what we're looking at as scouts, and that I was maybe a sophomore in high school, and you think about that, and that was the mindset back then, and talking with a bunch of Dodger pitchers as I did, like Don Newcomb. Don Newcomb at one point for the Brooklyn Dodgers, when he was playing before he got to the Brooklyn Dodgers in the Negro Leagues, he played a triple header in one day and he pitched every inning. And he was telling me, he said that was the norm. And, you had 300 inning pitchers like Roger Craig, Drysdale, Koufax, and they were all completing games. You would never hear of anything like that now.
Right.
It's very seldom.
Well, it's interesting because you have to dig into the history of baseball and sports in general. But we also talked about this, and I mean, you can't even compare with a guy like a Sandy Koufax. I mean, never saw the man play in person, but obviously one of the all-time greats, right? But if you compare, I would think, and correct me if I'm wrong, the speed at which the ball is released from your Tom Glavine's or your Greg Maddoxes and even today's pitchers versus the speed of the ball that came out then, there's no comparison. So the amount of force that your Tom Glavines and your Greg Maddoxes and your Nolan Ryans and and even some of your more modern day pitchers, you can tell I haven't watched baseball in a while. I don't even know who's pitching these days. They can't sustain that level of play like the guys from yesteryear could. I mean, look, Babe Ruth is, right now the comparison between Aaron Judge and Babe Ruth about batting, right? I don't think there's any comparison. Babe Ruth, was a great baseball player, but to say that Babe Ruth is a great athlete, I mean, that's just almost comical.
Yeah.
So,
well, and that's interesting you say that. There was some discussion on, I think it was our Stewart station on WSTU, on Fox Sports, that the similar comparisons. Well, there just aren't any. Babe Ruth may have faced some pitchers 6 or 7 times in a year, and he could tell when they were getting tired, and he would hit a lot of home runs when they had tired arms. And it was simple as that. You don't see that nowadays at all.
Right.
And so, like, Aaron Judge can't, say that. He may see a guy 2 or 3 times, but that would be it.
Right. It's the whole argument. I mean, it's even the argument when people got into the whole Jordan versus LeBron argument. You know what I mean? And then people compare Walt Chamberlain to Michael Jordan. You know what I mean? I don't think, is anybody ever going to score 100 points in a game? No. Are you ever going to see an athlete that's 2 feet taller than the next closest competition? No. It's never going to happen again. So you take.
Yeah. And of course, I was fortunate to see a 100-point game by a woman, Cheryl Miller. and I'll tell you, Reggie used to joke about her all the time, that, even in his family, he was number 2 in the family because his sister was a lot better than he was. Yeah. But yeah, you're right. It's so different because the generations are different. And really the athletes now, because of folks like yourself, they have better medical. Even going back, the Dodgers always managed to have good team physicians at Sentinel Hospital, but they were one of the first teams that did that to such an extent. But you look nowadays, oh my gosh, it's like the medical care and the training is so much better.
Well, that's actually, what, as well as we do in getting athletes back on the field, and in theory, hopefully trying to prevent them from getting injured. We're kind of the last line of defense. You have a physician on the sideline at most of these major sporting events, and they're available for injuries, but it's really the athletic trainers that keep them prepared, with the protective bracing and taping and watching them on a day-to-day basis. The actual trainers themselves, the strength and conditioning coaches that keep them in tip-top shape and make sure they're keeping them stronger and faster and more mobile and correcting their form. All of that stems obviously from some type of baseline orthopedic, but it's kinesiology, it's biomechanics, it's the whole idea of sports science is, just blown up to, from nutrition all the way on down to the way you lift and the frequency at which you lift. That's what's changed sports. I mean, I don't even think we've reached peak human performance yet. It's this ever unattainable goal, so to speak. But when we try to really reach the human peak performance, I mean, that's going to be pretty astronomical.
Yeah, it's funny. And you talk about how things change. Joe Rose, who does the morning show in Miami, was talking about when he was with the Dolphins that you would come in at halftime and players would smoke. and coaches would smoke. And he said, I'm just amazed that I never got treated for secondhand smoke. There was so much smoke in the locker room. And, I can't even comprehend something like that, but it was true back in the day. It really was.
You couldn't walk through the entrance of an ER without walking through a smog cloud. Every doctor and nurse were in the parking lot smoking. I mean, think about all the clam bake that used to go on in the airplanes. You'd walk into a fuselage of an airplane and that's just one minor thing, not to throw the tobacco industry under the bus, but wow, look what we learned from that. Look what we learned about things like fatty liver and poor diet, and why cheeseburgers every night of the week aren't the best choice of food, and we really need to be eating our leafy vegetables and our greens and so forth. And that's just for the average person. Now you want to go into a competitive athlete person, so forth. It's a different story. Did we lose Dr. Joe? I thought I heard him on when we got on.
Actually,
was that an old?
That was a best of.
Oh, there you go.
Of both of you, as a matter of fact. But yeah, you have to wonder. You bring up the food aspect, training tables and stuff like that. I mean, that is something that really directly affects the athlete, and some guys get it and other guys don't. It's just one of those things.
Yeah, no, I mean, it's, my kid's going through, he's starting to enter the phase where, recruiting is a big thing for him. And even at the college level, and I'm not even talking about, the high market college sports like football, basketball, the captains, they text the team, send me your diet, send me, what's your meals for this week. The Yale lacrosse is famous for this. You text a picture of what you're eating and you might get a text back that says, no, we don't eat like that. That's not what you eat.
Whoa, really?
Yeah. I mean, it's trying to understand fueling the body, peak performance, and just overall wellness. I mean, it's something that all of us can learn. You don't have to be a NCAA XYZ player to understand the importance of nutrition and health in your day-to-day life. One can argue that the trader on Wall Street that stands up for 12, 18 hours a day and is barreling through crowds and so on and so forth, needs to be in as peak performance as the college athlete. Maybe not the same way. You still have to fuel your mind and fuel your body. If you're an attorney or an engineer or airline pilot, you need to have peak performance. That you might not have the same goal that, say Reggie Miller has or Peyton Manning has, but you still need to be at peak performance to perform your job on a day-to-day basis. And that's where, we really have a better understanding of overall wellness and health and supplementation and vitamins and nutrition and how food interacts with our body, how bad food decisions equal bad performance and so forth. It is what it is.
I think the diet aspect of it really came into play. I'd like to say late 70s, early 80s, when a lot of the NFL teams, at least, had training tables, and this is what you guys are going to be eating for breakfast, lunch, and that all started in training camps. And a lot of these kids, as they came into the NFL, had never eaten that way before. And it really was an adjustment for them not to go out and have 5 cheeseburgers at McDonald's at midnight. It was one of those things.
Yeah. Oh, like I said, wellness is a much bigger picture, and the physician is only a small part of it. We usually, unfortunately, in the orthopedic world, we usually see you when there's a problem that arises. Dr. Wierzbecki's practice is a little different. He has a little bit more of a preventative medicine type role. I mean, yes, most people walk into his office or colleagues of his in sports medicine and family practice and so forth with a problem but sometimes they walk in there with an earlier problem that can be mitigated and so forth. A lot of times when you go into the surgeon's office, you've already passed that phase. You're getting the sequelae of X disease, and and there's a lot of studies that link arthritis to a pro-inflammatory condition, stemming both from genetics, from weight, and dietary factors as well. So it's the things we see on a day-to-day basis, the things that are essentially killing us or breaking our bodies down, really stemmed back to the choices we make. And a lot of times it's the choices we make in earlier life, just like you tied on. You get some of these early NFL players, these guys coming out of college. What is a training table? What is this? What is a diet? What is this? What is this lifestyle adjustment that I'm not accustomed to? And that's why we've talked about this in the past, preaching this at a younger level. Getting the kids to understand, getting helping parents set the example, teaching the kids, teaching in schools, making sure the diets are appropriate. We talk about meals in school, and then have you seen some of the school meals that they offer?
Yes. Yeah, I have.
Yeah, okay. It's nice that you're offering low cost meals or free meals. I think Palm Beach School District, for example, it's at least our school, the meals are free. I've not sat down and had one of those meals. I'm not sure what the sampling is, but I can tell you my kid brings his lunch every day. He's got 2 or 3 brown bags and then eats all day long. So it's making healthy choices, carry on to healthy choices as adult, carry on to longevity. So.
Well, now getting back to your son again, as far as the recruiting, my guess is, boy, that is amazing about Training Table, with the colleges being that aggressive now in his sport of lacrosse.
Well, I think it's more of a self-policing thing. It's just getting a better understanding of what makes you be able to function on the field. I can almost, when you have a better understanding of what it takes, then it just becomes ingrained in second nature. Even at the high school level, these peak performance high school football teams, lacrosse teams, soccer teams, basketball teams, whatever the case may be. Like, if you don't think the IMG basketball kids or the IMG football kids, somebody's watching what they're eating, that's an amazing facility, right? And they have amazing cafeteria, but I guarantee you that the football team is not going to the pizza shack that they have there in the cafeteria every time they have lunch. It's just a totally different environment, and whether the coaches are responsible for that or it's the players that are policing one another, it stems from somewhere. And that, again, it comes from an understanding at a younger age of what it takes to be peak performance, what it takes to be healthy, what it takes to have a lifestyle adaptation. And that's where, for me, I have a trouble with when you see these younger kids. If we don't have the opportunity to teach kids at a younger level, and it also is very challenging. Then you get into the whole social aspect of things. Eating healthy is expensive. Let's exclude inflation. If we could take the last 2 or 3 years off the table and just talk about, go back 5 or 10 years. It is very expensive to have vegetables constantly available, good healthy meats, proper oils, and then it also is a time investment. How many of these boutique meal prep companies have you seen pop up over the last 5 years alone, where
Sure.
you can get pre-prepared meals? They're healthy meals made with wholesome, high quality foods and ingredients and so forth. It's just, people are really starting to wake up and realize that, hey, look, yeah, it's nice to go into the drive-through once in a blue moon. I could tell you, I was floored. Coming from New York, where you think it's the convenience of the world, I don't think we have half the drive-throughs that they have down here in Florida. Now, I don't know if that's because it's hot, people don't want to get out of their car. We love it down here, but getting out of your car to go get your McDonald's, even though it's only a 10, 15 foot walk, or maybe a 50-foot walk, at least you're walking 100 feet to and from before you walk down to Big Mac. You know what I mean? As opposed to, sitting in your car.
Yes.
So anyway, it's the lifestyle change. It makes it hard, but we have to teach the kids. We got to get them ingrained in school. We got to keep them with their physical fitness levels. Um, and we're getting away from it. We've talked about this before. I mean, obesity is going up in this country. The death age is dropping, and the obesity rate is rising. And if there's a clear linkage there to heart disease, joint disease, kidney disease, pulmonary disease, so on and so forth. So then we've gotten
Well,
completely off topic from peak performance of college level athletes, of course.
well, but and you have always, going back 15 years, Dr. Sellards as well, have stressed the body mass index, the fact that, especially with your knees, the added weight puts a lot of pressure on those knees.
6 pounds. Every 1 pound of weight is 6 pounds. The knee sees 6 times that force.
Ooh,
So,
I didn't know that.
so think about it. If you're 50 pounds overweight, that's 300 pounds of unnecessary pressure that a knee is seeing. And that's just regular. That's before you start trying to run and walk and pound. We're just talking about regular old, just weight, just gravity. Good old Newton.
Wow. That's a staggering number.
No, it is.
It really is.
And it helps. It helps as a surgeon. It helps as a physician, and it should help as a family practice physician. Anybody who treats obesity, and you're trying to, at least from an orthopedic standpoint, it helps with the conversation, because a lot of people have this belief that they have to lose 100 pounds or it's not worth losing weight. Yeah, if you're 120, 130, 150 pounds overweight, yeah, it'd be great if you lost 100 pounds. Duh. I mean, that makes sense. But that doesn't mean 50 pounds is not valuable. And it's like everything else. I mean, most people don't quit smoking overnight, right? You don't go from a pack a day to no cigarettes overnight, never pick up the cigarettes again. You're alcoholics, you know what I mean, that have drinking problems. They don't go from, drinking heavily to stopping cold turkey. Now, yeah, of course there are people that do it, but the vast majority, it's a give and take. It's a give and take. It's a weeding out process. They finally realize that, hey, I feel much better this way. Same thing goes for weight loss. If you have 150 pounds of weight to lose, and you aim to lose 150 pounds of weight, and you don't get there, that's a frustrating thing. But if you set smaller goals, hey, look, I want to lose 20 pounds. Oh, wow, I did that. Look how much better I feel. Now I want to lose another 20 pounds. Or now I want to go for double or nothing. Let me lose 40 pounds. You lose 20 pounds in, say, 3 months, and then you lose another 40 pounds in another 3 to 6 months. You're 60 pounds lighter. You're a third lighter than you were when you started. And you probably feel better. And it just makes sense. You know what I mean? I always try to tell my patients to set small, achievable goals. You know what I mean? Aim for 20 pounds. Because 20 pounds is 120 pounds less pressure on the knee. They feel better.
It's funny, even with us, Carol and I try to have salads every day, and I make the salads at home at night, and that has made a big difference for both of us. It really has. It's amazing. I mean, we've lost weight, not even intentionally. It's just happened because we're eating like that now.
Right. Well, I mean, that's also the big misnomer, is that, people, they feel like in order to lose weight, they don't have to eat, or they need to stop eating. And there's all these fads, right? There's intermittent fasting, there's keto, there's Atkins, I mean, you name it. There's all these different tricks, and you'll always find somebody that swears by the method that they've utilized that was successful for them. And you can't argue with that. But most of those fads aren't for everybody. Most people can't go keto. Most people can't go Atkins. Most people can't do intermittent fasting. It takes a different level, of commitment to do all these things. But it's not as challenging if you make it a lifestyle adaptation. So, for example, like, I wouldn't advocate for you and your wife to just eat salad for the rest of your life.
Right.
Like, you still have You still have to put some meat on the salad. You still have to get your well-rounded balance in. Now,
Correct.
yeah, you might have to change. Some people swear by the whole macros. The whole idea of fats, carbs, protein, and measuring and balancing those. There are plenty of books that say that that's the way to go, and there are plenty of books that say, don't focus on macros, focus on nutrition and nutrients. It really, at the end of the day, with a couple of exceptions, it's calories in and calories out, and that's the simple thing. And in this country, my wife is from Europe, and she was raised in a different mindset. Now, granted, she was raised in a communist country where they had bread lines and all the other things, but they don't have. And even in today's Europe, you go over to Europe. I mean, you've been to Greece, Italy, France, any of those places. You don't see the size plates that we see here. We're so used to these huge servings.
Right.
I mean, you can go to any dinner at any given moment, unless you're at a fine dining establishment in Manhattan or Miami or Fort Lauderdale or one of these like uber exclusive places that advertise being a tapas menu, so to speak, or a tasting menu. You get a massive plate of food, and imagine how many calories are, in a family dinner at Outback. You get yourself a ribeye with a salad and a baked potato, and then you have a glass of wine or a beer. I mean, you're looking at a 2,200 calorie meal. That exceeds most
don't forget
people's...
the bloomin' onion, pal.
Right. Well, that's without the appetizer. I mean that exceeds your entire daily intake of calories in one meal.
Yeah.
Now you get a second beer, God forbid, you know what I mean? Or you double dip in the sauce. I mean, you see how quickly you get to 3,000 calories.
Sure.
Now, okay, it's nice to do that every once in a while. You're allowed to have those cheat days. You're allowed to have those splurge days. But you have a 2-parent working family. Takeout is the way to go. It's hard to get to the store. And they just, and even now, obviously this is a rare exception. They just published recent data that it's turning out it's cheaper to buy food and go to takeout than it is to go to the store right now.
Wow.
So, it's just, so if every night of the week you're having, your entire day's worth of calories with one meal, and then you're also having breakfast, you're also snacking during the day. I hate to throw Starbucks under the bus, but you know how many calories are in a Frappuccino or a venti mocha, or 750, 800 something calories in your coffee drink.
Yeah.
And your daily allotment of calories is what, 1,700, sometimes less.
Well, so. And you talk about things are so different now. And I think back, you've got parents, and they may have a daughter in cheerleading or dance or something like that, and a son in football, and you're driving people everywhere, and yeah. It's like, and it's just as you say, you're gonna pick up something because there's no time to cook.
Right. It's very challenging. We go through it ourselves. I try to, trust me. I'm in the process of trying to trim down myself, but we make sure my son doesn't fall into this trap. So I've utilized some of these meal prep places. There's an actual place locally, down in Palm Beach area, which we use is phenomenal. I won't plug them because they're not paying me to plug them. But they do a great job. So we'll get some of the pre-prepared meats, steak and some chicken, and just have it available so we can just heat that up for him, on the nights that we're going to be late. Does he do his Culver's run every once in a while? The entire lacrosse team lives at Miller's in freaking Jupiter. They have their own table. It's ridiculous.
With a name plaque on it.
Yeah, with a name placard on it. Yeah, it's just when he's getting out of practice on Sunday, it's just which Millers are you going to? You're going to Abacoa, or you're going to go to the one in town? But they make smart choices when they're there. You know what I mean? That's the thing. Getting yourself the chicken tenders as opposed to the triple cheeseburger. You know what I mean? And it's stuff like that. You're allowed to do those things, especially at a young age. Kids are a little different. You know what I mean? They can eat like garbage disposals, and that they don't gain weight. And in fact, kids need extra fat and cholesterol and so forth, because that's the building blocks of steroids and their testosterone and basically their growth hormones. You want those building blocks as young kids. As adults, you don't need triple cheeseburger, you don't need zingers, you don't need Big Mac, you don't need 3,000 calorie bloomin' onion steaks, salad, so forth. So, and again, it's just a different lifestyle that we have in this country, and it's nationally. It's not just Florida, it's not just New York, it's nationally. The portion size in America is insane. I mean, they argue that if you should be able to have the portion of your food based on the size of your fist. When's the last time you had a meal the size of your fist?
Yeah. Oh, yeah. Well, and I remember back to when I was a little kid in an Italian household, and oh my goodness, grandma and grandpa would go crazy if you didn't clean off your plate.
Right.
And that
Again,
was in the 50s.
you're allowed to do that. I mean, there's a lifestyle. I mean, whether you call it sauce or whether you call it gravy, when you sit down at 1 o'clock on a Sunday to eat, that's what you do. You know what I mean? But that's not every Sunday. It's just
Correct.
And then, but the other thing that we're losing is that generation was also a more of a hands-on working generation. You know what I mean? People ate like that, but they were walking a lot of places to and from. They were on their feet a lot. They were 12-hour days in the farm, 12-hour days, in the fields, 12-hour days pushing a lawnmower. Not to say every Italian family was a landscaper or a mason, but that lifestyle adapted from a lifestyle that they had when they came over from Italy, which most people didn't have cars. They were working, they were in the fields, they lived a completely different lifestyle. And then they came over here and the lifestyle changes. I had this when I was in Brooklyn. I used to talk to my patients all the time. Central Brooklyn, we had a very large Caribbean population. And I had a lot of patients that were very vocal, because if you go to the true Caribbean, people walk everywhere. They're in the fields.
Yeah.
The women and the men are super skinny because they're always working. Whereas the Caribbean American patients, their body habitus is a little bit different. You know what I mean? And it took a little bit of courage on my part. It's just because it's hard when you're trying to counsel patients to have, with about weight loss and about joint problems, and as a resident, for example, training in these areas, and you try to get someone under. So when did this start? Well, it started when I came over here, because they don't have access to the things that they have access to here. If you're a Caribbean in the Caribbean, yeah, they have food, but they don't have access to it like 24/7, 365. And the ability to make bad choices, and then when you make bad choices and you have huge portions, it compounds on the problem. So it is what it is, but we don't always talk about this at Florida Orthopedic Specialist, but we do tend to talk about it at our office pretty regularly. I bring it up quite often because there are a lot of patients that are not candidates for joint replacement surgery because of problems like this. We talked about this thing last time we were all on here together with the NYU study and looking at BMI and negative side effects. So, if you want to have a weight, loss counseling conversation, come visit us. Dr. Wozbecki and I know Dr. Wozbecki and I bring it up in our practice all the time. It's just one of these important things because you really might change somebody's life. So
yeah, and you are right. In a way, you are really the last resort for folks, but we've got to be in relatively good shape to make sure that those kinds of surgeries are going to be successful.
Exactly. I mean, to go through a knee replacement is a big deal. To go through a revision knee replacement because you get an infection, or you get wound breakdown, or the hardware fails, you know what I mean? And I used to have this problem when I was up north, is that we have the data and we know the right answer, but we kind of make exceptions more often than we probably should, simply because we know if we don't do it, they're going to go down the block and someone else is going to do it. Now in my older age, and now that I'm on the other side, I'm not on the student side, I'm more on the professor side. You really have to start paying attention to this data. Am I doing the right thing for somebody? But then the challenge is if you get someone that comes in with a debilitating knee problem, a debilitating hip problem where they can't walk, how do you tell that person, yeah, go to the gym, go exercise, go work out, lose 80 pounds, and then, then we can fix you. The goal is to try to catch that way before. The arthritis may be inevitable. Like I said, there is a genetic component to it. There is an inflammatory component to it. Most patients, if you're going to develop a arthritic condition of a joint, it's a lot of patients already have their fate sealed. I can't tell you every patient I see is large. There are plenty of patients that are skinny and BMI appropriate or less and have arthritis. It's those you're not really worried about. It's the other ones that you want to try to capture, then prevent them. So if they do develop a problem, you can help them with their problem down the road. So,
sure.
But it is what it is.
Yeah. Oh, yeah. Well, I think it is amazing that you talk about some of the meal prep companies. Yeah, I've seen a lot of those commercials on television now, and it's becoming very popular.
Yeah, I mean, it's you have a working population. You have people. There are a lot of people that are staying single longer. Now we're really getting off topic, but there are a lot of people that are staying single longer. They work long hours, and it's we all saw Lethal Weapon 2, where they shop at the end of the day on their way home. That's you don't do that anymore. No one gets out of work at 8, 9 o'clock at night, goes to the supermarket so they can go home and cook at 10 o'clock. So some people meal prep early in the week. That's a big thing, but that takes a long time. It takes a lot of commitment. So these other these companies have caught on, and they provide healthy meals. They're well proportioned, so on and so forth. So it's whatever the formula is, just pick one that works for you. That's all that matters. If you maintain the in less than out, or at least your in and your out are balanced, you accommodate for the days that you have that Outback, or you have that Frappuccino, or maybe you go get your zingers. Just the other days you just got to be smart about things, or you make sure you do a little extra running that week, or you have to keep a mental track of it. And if you don't, use your phone, use your calendar. There's apps out there that you can at least approximate and regulate. Really makes sense in the long run. So.
Yeah, our Apple phone has got a little health thing with the heart and stuff, tracks steps and everything. It's amazing.
But there's even calorie app, like I like My Fitness Pal, for example. My Fitness Pal is free. You get the entry level one. You don't have to pay for the the golden version. But you can literally plug in calories. You can actually scan the things that you eat. And it'll calculate it for you. It'll tell you the nutrients, the vitamins, the minerals, so on and so forth. And like I said, do that for a week. You'll be pretty surprised how much you're eating.
Yeah, it's amazing. Well, doctor, where do we find you folks at Florida Orthopedic Specialist?
We have our two offices. It's at St. Lucie and in Stewart. One off of US 1 and one just on Indian Street in Willoughby. The same number to get both of us, 772-335. I forgot the number. 4400. I forgot the number for a second there.
4550.
4500. Yes. Sorry. I was given the hospital number there. Yeah. But give us a call anytime. It's one number for both locations, and we'll see you next week.
All right. You have a good one.
You too.
You've been listening to Bone Talk right here on WPSL, Port St. Lucie. Talk to the Treasure Coast, webcaster to the world.